Welcome back, everyone. The next thing we are going to talk about is maintaining the register. Before we say anything about this topic, I think the first question should be this. What is a register? Here is the dictionary definition: a variety of language used for a particular purpose or particular communicative situation. Particular situation. Well, that's kind of confusing, isn't it? In other words, a register is just another way of saying something. Still not following? Let me try to give you an example here. Have a look at these sentences. Hello, how have you been? And, hey, long time no see. And, yo, what's up? What's new, man? You see, these three sentences basically mean the same thing, right? It's something that you would say to another person that you haven't seen in a long time. But what's different? It is how formal the language is, right? Like if I ran into someone that I met once long time ago at a cocktail party, I wouldn't just go, yo, what's up? But if I were to see my high school friend, then I wouldn't worry too much about how formal I am with my language. This is what essentially a register is. A register is simply how formal, complex, or difficult this specific word or language is, and having a different register means you are saying the same thing but with a different formality. Here's an example. Do you know what urinalysis is? Urinalysis is a medical test of your urine to detect and manage a wide range of disorders such as urinary tract infections, kidney disease, and diabetes. Well, that sounds a little bit complicated. Can you think of another term that we use for urinalysis? Yes, a urine test, right? So think about this conversation. There's me, a 3-year-old baby Mason. Yes, that's actually me. I know, very cute. But I want you to think about a conversation between the doctor and this baby Mason. Should the doctor say, A, hi Mason, we need to perform a urinalysis before you get discharged tonight? Or B, hi Mason, we need to do a urine test or even a PP test before you can go home? I think it is pretty clear. Any sensible doctors would say B rather than A to a young child who might not understand English with technical medical terms. This is what I'm talking about when I say a register, urinalysis, urine test, PP test. They all mean exactly the same thing, a test of your urine. But you also see that urinalysis sounds much more difficult than the urine test or a PP test. We use the term register to explain when one word sounds more difficult than the other. So in this case, we say the term urinalysis is a higher register term of urine test or a PP test. Or we could say the PP test has a lower register than the term urine test or urinalysis. I hope this is not too difficult to understand so far, because this honestly can get pretty confusing later on. If you understood what the register is, here is my question for you. Why do we need to learn about the register? Why do we need to know? Well, the answer has been already given to you if you paid attention to the name of this lesson. It's because interpreters should maintain the register when we interpret. To be more specific, we should try to preserve the register of a utterance and provide a rendition that has the same register whenever possible. Let me show you what that looks like. Let's say we are looking for two words that are linguistically equivalent. For me, that would be English and Korean, and once again, it can be different language depending on what languages you speak. I want to find a word in both languages to mean this. What is this in English? We call it an apple, right? And in my language, we say 사과, which means apple. As a translator or an interpreter, we always try to find the words that have linguistic equivalence, because that's how we transform the source language to the target language, right? But often we don't have this one-to-one relationship. Sometimes you will have this word, English prime. What is this English prime? This is just my way of denoting that these two words have a register relationship. So the English prime word is either a higher or lower register term of the original English word. The same could happen for Korean language as well. We could have a Korean prime word that is either a higher or a lower register term, and now we have four terms that have the exactly same meaning. I hope you are with me so far. I want you to understand that it is definitely possible to not have this Korean prime word. We just might not have a different register word for that Korean word. And vice versa, for the English word, we just might not have that English prime. Or sometimes we might not have any of these words with different registers in any of the languages. That's perfectly fine and actually also very common. But let's just suppose that we have all four of these words. When we know there are these four words, they all have the same meaning. For example, this Korean word and the English prime word, it would be in a different register, but they have the same meaning. The other way around is also true. The English word and the Korean prime word, they have the same meaning as well. So in conclusion, we have this pretty looking symbol everywhere to show the linguistic equivalence and the register relationship. Now, let me give you an example. Here is a random word, a kneecap. What is a kneecap? A kneecap is a flat, rounded triangular bone that covers the knee joint. Now, let's put kneecap in the English word section. Well, unless you speak Korean, I don't expect you to know how to say kneecap in Korean. And even if you do speak Korean, it's okay if you don't know. I'll just tell you. In Korean, we often use this term 무릎뼈, which just means a kneecap. Now, here is a question for all of you, whether you speak Korean or not. I want to find another English word noted as English prime here that is a higher register term of kneecap. What does that mean again? A higher register? It means I am looking for a word for kneecap that sounds more difficult, basically. If you don't know what it is, I want you to pause this video and quickly go find it, Google it. I'm not going to tell you what you need to type in the search bar, but I want you to find another for kneecap that sounds more formal or technical. The answer is patella. The patella is the medical terminology for your kneecap. As soon as I say this, people start going, but isn't patella technically different from kneecap because it is the medical terminology for saying kneecap, which is a more common way of saying it in a casual conversation, blah, blah, blah. No. I'm sorry, but you are just wrong on this one. A kneecap is a patella. A patella is a kneecap. There is no difference whatsoever in terms of the meaning or what it actually is. The only difference is the register, as I mentioned. Many English-speaking individuals will agree that a patella sounds more difficult and less common than the word kneecap. And that is all the difference we have. Now, for my Korean-speaking students, are you able to find a Korean prime term here? In Korean, we have another term called 슬개골, which is, once again, just a higher registered term of the original term, 무릎뼈. It just sounds more technical and difficult, but it means exactly the same thing. Now, we have all four of these words in front of us. Just in case you forgot, let me remind you why we are learning this. We are learning this because we, as interpreters, should maintain the register. Here is an example. Let's say you are interpreting for a doctor and Mr. Mason, a patient who got into a car accident. The doctor says this, Mr. Mason, your patella is all shattered. We need surgery right away, in English. Here, as an interpreter, how should we interpret the doctor's message? A, Mr. Mason, your patella is all shattered. We need surgery. B, Mr. Mason, your kneecap is all shattered. Which one should we say? Of course, the answer is A. your patella is all shattered. Why? Because we said we are going to maintain the register, right? The doctor clearly said patella in English, and we have a higher register term in Korean to match that, so there is no reason for us to lower the register to kneecap. But I have another question. What if the interpreter said B instead? What if the interpreter, for some reason, maybe didn't pay attention during my class, or maybe didn't know what they were doing at all, just decided to say kneecap? What happens? Is this a misinterpretation? Well, do you remember what constitutes a misinterpretation? We talked about this. If you don't remember this, please go back to the part where we talked about what makes a misinterpretation. We said if there are additions, omissions, or meaning alterations, there is a misinterpretation. If the interpreter said kneecap instead of patella, did the interpreter really change the meaning? No, they did not. Not maintaining the register does not mean there is a misinterpretation. This is something that I would like all of you to clearly understand. I said that interpreters should maintain the register, not must maintain the register. Just because we didn't keep the same register, that doesn't mean we misinterpreted something. Then, does this mean it's okay to not keep the same register? No, I still want you to try if you can. If you have all 4 words in your brain, then you absolutely should maintain the register. There are many reasons why interpreters should maintain the register, but one biggest reason would be providing immersive interpreting experience for our clients and LEPs. That means we are focusing on being a conduit, being a shadow, and facilitating this conversation as if the interpreter does not exist. Another reason why we are learning about the register is because just like urinalysis and patella, there are so many medical terms that will have different registers. For example, what do you think a lower register term for a cardiologist is? A cardiologist is a doctor who specializes in the patient's heart, right? So simply, we could say a heart doctor is a lower register term for a cardiologist. How about hepatitis? In medical terminology, when we say hepa, it usually has something to do with your liver. When we see something that ends in the itis, it means it's inflammation of some sort. So I hope it's not too difficult to find the lower registered term for hepatitis. That would be liver inflammation. How about finding blood in your urine? I don't think anyone wants to see blood in their urine, but if you do, I highly suggest you go see a urologist right away. Can you find a higher registered term of blood in your urine? See if you can do it. Quickly pause the video and use your resources, whether that is Google or YouTube or encyclopedia, Wikipedia, whatever it is, try to find the medical term for blood in your urine. The answer is hematuria. Also, this word has a root word hemat, which has to do with blood, and urea, which has to do with your urine or urinary tract. We are going to study a lot more of these medical terms, different registers, and root words later in the lecture. But for now, I really hope you can have a clear understanding of what I meant about register when we're interpreting. Next thing we will talk about is circumlocution. What is circumlocution? It kind of sounds difficult, doesn't it? It's a big word and that we don't normally use every day, for sure. But let me look up the definition for you. Well, here is the definition that you would find on Google if you look this up, which is indeed the definition of the term circumlocution. But I want it to be understood slightly in a different way. So let me introduce a better term that is a picture word. From now on, when I say a picture word, I am talking about a circumlocution. So now the question is, what is a picture word? But before we talk anything about this, I'd like to explain something first. Earlier, as we discussed the concept of register when we are interpreting, we talked about linguistic equivalence. For example, an apple in English is 사과 in Korean. Like this, when we're interpreting, we will always be looking for the right linguistic equivalence to transform our source language into the target language. That's our job. And sometimes our job is easy, sometimes it isn't. Maybe we have a client who is simply asking for the LEP's name. If I ask you to interpret this sentence, may I have your name? I personally don't think you will find that very difficult. Well, at least I really hope that's not too difficult. But if I get you to interpret this utterance by the doctor, sir, you can get your COVID vaccine at one of the drive-through clinics. Maybe it's still not too difficult, but more likely that you will get stuck on something like drive-through clinics. Maybe it's not a very common word. Maybe this term doesn't have a clear linguistic equivalence in your language. Just like that, some words are going to be relatively easier to interpret. Name, apple, tree, love, fish. I don't think it will be too difficult for anyone who is watching this video to find the linguistic equivalence of these words in their language. But what about words like this? Drive-through, farmer's market, petrichor, friend zone, hangry. You will instantly notice that some of these words are quite difficult to find in your language, or in some cases, they might not exist in your language. Think about this example. How do you say a drive-through in your language? You know the drive-through, like McDonald's, Starbucks. You stay in your car and order as you look at this giant screen and pay at the next window kind of deal. You know what a drive-through is. But how do you say it in your language? Well, in my language, it's actually quite simple. We just keep the English word and say drive-through. Which I hope you are able to still hear it. It's just a Korean way of saying the English word drive-through. In fact, this is how it is said and written everywhere in Korean. Korean people who live in Korea and don't speak English will use the term drive-through without a problem. So I know that the linguistic equivalence of the English word drive-through would be just keeping it as is in Korean, drive-through. But let's have a look at another example. The word is hangry. Well, the word hangry is just hungry plus angry, right? When you're angry because you're hungry, you are hangry. But when I try to think of a word in Korean, I actually cannot find one word that fits this perfectly. I definitely wouldn't keep this in English and use it as hangry in Korean. So if I were to interpret this, what would I do? I would just simply explain or describe the word so that listeners can understand the correct meaning of the word, hangry. And this is what I mean when I said it's circumlocution or a picture word. One of the most common problems you will encounter when you interpret is going to be, how do I say this in my language? With the internet, you can find almost everything, but definitely not everything. There are situations when we straight up just don't have the linguistic equivalence. And that's when we are going to use a picture word instead. Let me give you another example. Do you know what this Korean word 눈치 is? Once again, if you're a Korean speaking person, you would probably know it. But if you don't speak Korean, which I'm assuming the vast majority of you don't, will have zero idea what this is supposed to be. So let me explain what 눈치 is first. Let's say you and your two friends, total 3 of you, are having pizza. You're all very hungry, and the pizza smells so freaking good. Before you know it, there's only 1 slice left. And let's just suppose everyone equally had the same amount of pizza so far. So you are sitting there thinking, everyone looks still hungry. Should I suggest to split it, maybe? And then that's when Lisa, the selfish kind, just takes that final slice and goes, yum, that's mine, and devours the last slice. We say that this friend is lacking nunchi. This Lisa doesn't have nunchi. Do you kind of get what this means? Well, if you are curious about this for some reason and you look this up, you will probably find a better explanation with some more examples. But in a nutshell, it has to do with the social sensitivity, like being able to read what others are thinking or wanting. So can you think of a word that describes this in English? I can't really find a perfect one word that can be considered linguistically equivalent to 눈치, understanding what 눈치 is supposed to be. But what if we described or explained what this is as concisely as possible? I would probably say it is an ability to read the room. In English, we do have this expression, reading the room, which has to do with that social sensitivity that you are sensing what others are feeling or thinking. And again, this is exactly what I mean by the picture word. To describe this with words, I could say it's an explanation or description of a term that we do not have linguistic equivalents for in the other language. Let me give you an example that is not in Korean this time. Let's say you are interpreting on an auto insurance call, which is a very common call if you are working as a remote interpreter for an LSP. The claims adjuster says this to your LEP. Ma'am, did you perform a shoulder check before switching lanes? How would you interpret that in your language? What does a shoulder check mean? In case you're not familiar with the term, let me explain it first. Let's say you're driving. You're driving that blue car right here. And you want to switch the lane to your right. What should you do? You need to first check if there is a car on the right lane that you are trying to go. We turn on the right turning signal, the blinker, and check the side view mirrors to see if there's a car or not. In this case, we do have that green car on our right. The thing about your side view mirrors is that it has blind spots. As you can see in this image, you can only see certain angles that it can be really dangerous because cars that are right next to you, for example, this green car on our right, is completely falling in our blind spots. So we might not see the car in the side view mirror at all. That's why when we are switching lanes, we are supposed to do a shoulder check, which is an action of turning your head left or right over your shoulder to see if there are any cars in that blind spot. So now we understand what a shoulder check is. Then the question is, how are we going to interpret this? If I say, did you check your shoulders before switching lanes in my language to the LEP, I am certain my LEP will be really confused. Why? Because this term shoulder checking does not exist in Korean. So in order to interpret this term shoulder check, we have to use a picture word. How would you describe this shoulder check? I would say it's an action of turning your head to check your blind spots, right? That's what a shoulder check is. So instead of using a literal interpretation and saying checking your shoulders, in my language, I could say, did you turn your head over your shoulders to check if there were any cars coming before switching lanes? Or more simply, we could say, did you turn your head to check the blind spots before switching lanes? If the linguistic equivalence of the term shoulder check exists in your language, then good for you. You should obviously go ahead and use that for your rendition. However, if you understand clearly what shoulder checking means, and that such term does not exist in your language, then you will use the picture word to deliver the meaning for meaning interpretation. So now we understand what a picture word is. I want you to be careful. When we incorrectly use the picture word, unlike the register, this becomes a misinterpretation. Let me show you. The doctor says, it looks like we'll need to do coronary bypass surgery. If you don't know what coronary bypass surgery is, please feel free to look it up. This interpreter kind of understands the coronary bypass surgery. At least he knows that it has something to do with the coronary arteries. So the interpreter does this. It looks like we will need to do a type of surgery on your coronary arteries. What just happened there? This is not a picture word. The interpreter tried to explain the coronary bypass surgery to the LEP, which isn't something he should try to do in the first place, not to mention that his explanation is vague and can be misleading. Please be careful with this. Here are some things you must consider when you are using a picture word. First, you have to make sure that you are using a picture word because there is no linguistic equivalence, not just because you don't know what the linguistic equivalence is. For example, I know there is no perfect word for a Korean term like 눈치 in English because I did my research. I looked it up and I could not find anything. In fact, I thoroughly understand that this is a culture-specific concept that concretely exists in the Korean language, but not in English. But what about a term like coronary bypass surgery? There is a term for it in Korean. It's called 관상동맥우회 수술. I don't know if it exists in your language, but maybe it does, maybe it doesn't. But whenever you are using a picture word, I want you to always double check. Am I using a picture word because there is actually no word for it in my language, or just because I don't know what it is? I just don't know what the word is. And I understand having a clear answer to this question isn't always possible, and finding the right word can be often very challenging. But being able to use your resources to find the right linguistic equivalence is part of your responsibilities. Like, that's literally our job. So let's do our job. Let's look it up. Let's study. Ask other people. In my opinion, if an interpreter is using the picture word, that should mean the interpreter is absolutely sure that there is no linguistic equivalence. Another thing you must consider is how sure you are about the accuracy of the picture word you use. When I use a picture word for a term like a shoulder checking, I know I am absolutely correct because I have done my research and I understand it. A shoulder check when you're driving a car means you are turning your head to check over shoulders to look in the blind spots that you cannot see with your side view mirrors. Would anybody come up to me and say, "You're wrong. That's not what shoulder checking means"? No, I don't think so. I personally think this is just one of those things that if you know, you know. So make sure you know what you are saying. However, if you ever have the slightest doubt about your understanding, I think it is always safer and smarter to step out of our conduit role and confirm the meaning as a clarifier. Instead of panicking and trying to find the right way to use a picture word, just simply ask your client, "Hi, this is the interpreter speaking. I am not familiar with the term shoulder checking. Could you explain what it is?" Yes, this might slow down the pace of the call and interrupt the call flow, but remember our number one goal is accuracy and completeness. I hope this is clear to everyone. Next topic I want to talk about is what we call NATO phonetic alphabet. I am sure many people kind of know what this is, but in case some people don't, I think I should mention this because as an interpreter, we use the phonetic alphabet all the time, especially as a remote interpreter. So, what is this? You probably have seen something like this in a movie. This is Alpha, Bravo, Charlie, Roger, something like this. NATO phonetic alphabet is basically a set of code words that you can say instead of the alphabets because it is easier to hear and understand. When we are working as an interpreter, we deal with spellings of things all the time, such as people's name of the street or city, some member IDs with letters or passcodes. There are definitely times when interpreters have to spell out the letters to clarify things, and saying A, B, C over the phone repeatedly to check the spelling is really not that easy. So we use this NATO phonetic alphabet. I am not going to read it all out, so you can always pause the video to have a look if you need, or just look it up. Google NATO phonetic alphabet and you will find the exactly same thing that I'm showing you. One thing to note, it doesn't have to be always this specific words. As long as the word you say is easy and clear sounding, I think generally it works. Usually some animal names or common people's names or easy things could all work. The words I have put in red are the ones that many people use commonly instead of the NATO phonetic alphabet. One thing I should warn you is if you are going to use different words, make sure you know which word you are going to use. I have done this myself before. When you don't have the word in your head prepared, it is so easy to just mess things up. I have had one of my LEPs trying to do this in English, but saying something like, E as in igloo. And I had to quickly clarify that so the client doesn't misunderstand. I am not saying that you have to memorize this, but honestly, the first year of my interpreting career, I always had this in front of me. So when I had to spell things out, I could just quickly look at this chart so I don't stutter too much. So if you're not familiar with this, I highly suggest you do the same. I promise you, after a year or two, or maybe just like several months, you will have this memorized and use it without even thinking about it. I think this is pretty simple, but just in case you are not sure how you would use this on calls, let me show you. My client is asking for the spelling of my name. I say it's Mason, M as in Mike, A as in Alpha, S as in Sierra, O as in Oscar, N as in November. I think that is definitely the most common and standard way of saying it, but you could also say it like this. M like Mike, A like Alpha, S for Sierra, O for Oscar, N for November. It is basically the same thing. Easy peasy, right? There's one tricky situation that I do want to mention. Let's say our LP is providing an email address, which we'll just interpret. And let's say our client needs us to repeat. Here, technically, I could just go right ahead and clarify it with my LEP, but I can also just do this, just interpret and ask LEP to spell it out. At least from my experience, many LEPs don't know how to use the NATO phonetic alphabet, so when we ask for the spelling, all they will do is to just repeat the email address slowly to us. So I often confirm the spelling with the LEP first. Of course, we have to let the client know first, right? Here I'm basically using the phonetic alphabet with words that my LEP is most likely familiar with. For example, I know many Korean LEPs will understand T for t-shirts because we use the English word t-shirts in Korean too. So we get this confirmed by the LEP. Once we confirm the exact spelling of their email address, we provide the spelling using the phonetic alphabet. This is simple, but it can be super efficient. And I think practicing this at least once will really make all the difference when you have to use this on a real life call. So try it. How do you spell your name? Try saying it out loud with the phonetic alphabet. In this chapter, you will practice interpreting on your own. To maximize your self-practice experience, please listen to this instruction carefully. For this practice, your source language will be always English, meaning you will listen to an utterance in English and provide a rendition in the other language. Although it is not mandatory, it is highly recommended that you record your rendition with your phone or other recording devices you may have. Before each utterance is provided, there will be a 3-second countdown for you to prepare yourself. Before you start, try to remember the 5 interpreting skills and how you should listen attentively. Hi, nice to meet you. My name is Dr. Mason. What brings you to the ER today? Once the utterance is given to you, there will be another countdown, but for 5 seconds this time. Use this 5 seconds of prep time to prepare your rendition without pausing the video. Even if you do not need the entire 5 seconds, try not to skip or fast forward the video. Instead, try to use the 5 seconds in full so you can provide a meticulous rendition. Once the 5 seconds of prep time is over, your screen will show that it is time to deliver. 안녕하세요. 만나서 반갑습니다. 저는 의사 메이슨이라고 합니다. 오늘 어떤 이유로 응급실에 오셨나요? There is no specific time limit on how long your rendition should be. But a general rule of thumb is not to deviate too much from the time it took for the original utterance. For example, if the utterance took about 5 seconds, your rendition is ideally also close to 5 seconds, not 25 seconds. In case you're not able to start your rendition within the 5 seconds of prep time, I would like you to practice identifying the problem and providing a solution verbally. For example, if you cannot start your delivery due to unknown terminology, you can pause the video and say, "This is the interpreter speaking. I was not able to hear what you said after your name. Could you repeat for the interpreter, please?" I understand it might feel silly to ask for a repetition because we are just practicing. So you have to go back and replay the audio. However, without this practice, you will not be able to use your tool professionally and coherently on real life calls. In case you made too many delivery mistakes, you can always start over the delivery. 안녕하세요. 만나서 반갑습니다. 저는 의사 메이슨이라고 합니다. 오늘 This is the interpreter speaking. I will start over my interpretation. My apologies. 안녕하세요. 만나서 반갑습니다. 저는 의사 메이슨이라고 합니다. 오늘 어떤 이유로 응급실에 오셨나요? When you start over, make sure to pause from your original rendition and professionally use the tool. Once your practice is over, I suggest you listen to the recording of your own rendition and evaluate it with the following checklist. For listening, did I listen to the utterance carefully and attentively? Was I distracted by anything? For understanding, did I understand the meaning? The 5 W's and 1 H. Any unknown terminology? Was I able to quickly look it up? Was I able to use the tool professionally? For remembering, did I remember the gist and the details? Did I ask for a repetition properly for things that I could not remember? For note-taking, did I write only what's needed? Did I write down the numbers? Is there anything that I could have done differently to make my note-taking more efficient, such as symbols, lines, arrows, or techniques such as spacing or chunking? For delivering, did I provide a timely rendition? Did I have any delivery issues? Speaking too fast or too slow? Unstable rhythm? Being hesitant? Using fillers like ums or uhs? Mispronunciations? Not keeping the tone of voice? Or mimicking the voice? Lastly, did I misinterpret? Did I add? Did I omit? Did I alter the meaning? Did I maintain the register? Did I use the correct picture word? What could I have said that is better than my rendition? Did my delivery sound professional? There will be a total of 10 practice segments that will gradually get more difficult. I highly recommend that you try this practice multiple times. Good luck with your practice and see you in the next video. Sir, you look very pale. Do you feel like throwing up right now? Ma'am, your surgery was successful. You just need to rest and recover until you can start walking normally again. Besides the nausea and diarrhea, did you notice any other unusual symptoms in the past 2 weeks? Do you have any pain in your chest? How about shortness of breath or difficulty breathing? I'm going to ask you a few questions about your medical history. Are you allergic to any medication? Is there a family history of diabetes or cancer? It looks like you had your first colonoscopy 8 years ago. You're due for another one, and this time we will also schedule an endoscopy to be done at the same time. Will you be available on the 15th of this month for these procedures? The blood exam result shows that you have hepatitis B, which explains the abnormalities in your urine and jaundice that started 2 days ago. We are going to get you admitted right away. The moment you stopped taking the antibiotics, your kidneys, liver, and pancreas all stopped functioning properly. This medicine can be only given to you through an IV, so you have to stay here for at least a couple of hours. Your claim did not get approved by us because the prescribed medicine you received is no longer on our formulary. Please consult your doctor for any other alternative treatment options. Hematuria can happen for many different reasons, but it is probably best that you get checked by one of our urologists as soon as possible. When was the last time you took a medicine called omeprazole?